you have heard paragraphs and sentences saying that patients or people with comorbidities tend to have a worse clinical outcome once they get the disease. Comorbidity is a coexisting morbid condition or a coexisting disease. So, in case you get affected by corona or COVID-19 infection and you have an underlying disease, your clinical outcome is worse than people who do not have underlying comorbid conditions. So, first and foremost is systemic hypertension. People with high blood pressures need to get your blood pressure checked regularly and discuss with your doctor or consultant, at least online, and ensure that at this time your BP is under control. You have to be physically fit and have a healthy, nutritious diet, because in a study in China, out of 1,500 people, 16% who had a poor clinical outcome were hypertensives. Diabetes mellitus. Everybody knows that diabetes can cause immunodeficiency. So diabetes can, you can contract the disease because of diabetes, and if you have diabetes, your disease process may be really bad. So all diabetics have to get their sugars under control now and ensure that at this time your sugar levels are maintained. And apart from sugar levels, diabetes can cause end organ damage. So in case you need to, your scans are due or your master health checkups are due, get it done and make sure that your body is totally fit. Obesity again, your ideal weight is height in centimeters minus 100. So at this juncture, try to reduce weight as much as possible, either through exercise or through diet. Many obese people have had poor outcomes after having the COVID-19 infection. Underlying systemic diseases, systemic diseases of organs like heart, kidney, lungs, brain, all these conditions have had poor outcomes. We all know that COVID-19 and corona is a disease of the airway and lungs. So especially COPD, it is called chronic obstructive pulmonary disease. People with COPD have to get their regular medications and nebulizers and consult your pulmonologist, at least online, and ensure that your lung and your treatment is on the proper path. Cancer and malignancy, you have mild to severe, grade 1 to grade to the higher grades. So people with underlying malignant conditions again should consult your oncologist, and your radiotherapy, chemotherapy should be on the proper path now, because at this time you might tend to say that due to corona or COVID you don't go to a hospital or you don't continue your treatment, and things like maybe we can get my chemotherapy schedule later. That should not be done. Other subtle diseases like thyroid disorders. In thyroid you have hyperthyroid and hypothyroid diseases. So in this, many thyroid patients they do not check their thyroid levels for a very long time. Say like they leave it for 6 months, 1 year, and they keep taking their medications regularly. But at this point, it is better to get your thyroid levels checked and make sure that you are on a proper medication. In case you have low hemoglobin levels or anemia, kindly ensure that you have a proper, nutritious, healthy diet with high vitamin iron content, and take oral hematinics, that is oral folic acid tablets additionally, to ensure that you maintain a hemoglobin above 10. Everybody, just ensure that your treatment schedule is continued and you're on a normal path. Poor clinical prognosis after getting corona or COVID infections are above the age of 60. So anybody above the age of 60, kindly do not step out of your home. Go only when absolutely necessary. Anybody with these underlying diseases, kindly know that if you get corona COVID-19 infection, the COVID-19 infection is the primary disease, and these diseases which you have will be called as comorbidities, and anybody with comorbidities have poor clinical outcomes. That is, their condition might worsen, they might need a ventilator, and mortality also may occur. Eat healthy, stay nutritious, stay fit, and live your life. I sincerely thank Roundtable India and ESRT, that is E-Road Spice Roundtable 211, for this opportunity. Jai Hind.